Thanks for joining me for another Inside MKC, an opportunity to find out a bit more about how Milton Keynes Council is responding to the COVID-19 pandemic. We've got 4 items for you today, but before we look at those, just a quick update on the latest position with regards to COVID-19 positive cases. You can see from the chart that the good news is the rolling 7-day change in cases is at minus 38%. But it is worth highlighting that we're still seeing 88, 90 cases a day in Milton Keynes through one of our testing channels. So good progress being made, but still some pretty large numbers of people presenting with COVID. Now, one of the major developments this week has been the opening of the mass vaccination centre at Saxon Court, and Zara is going to tell us a bit more about that.
Hello and welcome to Saxon Court. Here at the vaccination centre, we are now receiving our first patients into the centre. When we're up at full capacity, we'll be receiving over 2,000 patients every single day, and as you can imagine, this is a great response to combating COVID-19 for Milton Keynes. We've been working closely across a huge range of partners to be able to deliver this programme, from the NHS, from Thames Valley Police and Bucks Fire and Rescue, and it's been a great example of partnership working. We've worked with some really good colleagues. We've also worked with a number of private companies such as BT, DP Design and Colour Crew, who've been undertaking minor building works and doing all the comms and branding for the site. Our highways colleagues and our contractors Ringway have also been working really hard to develop a coherent model for traffic management and have been busy getting all the signage up to enable people to access the site clearly, safely and without risk of harm. We've also been working with colleagues across the council, such as our legal team, our estates team, to ensure that we provide the NHS with all the assurance we need and meet health and safety standards.
It's been a challenging time for our waste and recycling services in the last month, and Nick's here to give us an update.
Thanks, Michael. So the past 3 to 6 weeks has been a really challenging time for the waste collection service and for some of our waste disposal facilities. But why is that? So over Christmas, we collected some of the highest amount of waste we've ever collected, which was exceptionally challenging on the teams. As we moved into January, we started to see COVID absenteeism amongst the crew start to increase. As it increased, unfortunately, by the time we got to mid-January, we had to switch off the food and garden waste service as we just didn't have enough crews to deliver both that service and our normal refuse and recycling services. As we progressed through into January and through over February, unfortunately, we continued to have staff go off and go into isolation, which meant that we've started to go through overruns, which meant that we weren't completing all of the services every day. We've also had some challenges with staff working at some of our waste disposal facilities as well, including the materials recycling facility managed by Viridor. So what is it that we're looking to do moving forward? So we'll continue to work with our contractors, namely Serco, who manage our waste collection services, and indeed Viridor, who manage the waste disposal facilities, to protect and support our staff and ensure that they're getting the support that they need and that their welfare is at the very core of what it is that we're looking to support them on. Please bear with us while we look to slowly bring services back online and we continue to support our staff. Thank you.
Now, behind the scenes, we're continuing with our work on enforcement, and Beth, one of our senior environmental health officers, gives us an update.
My name's Beth and I'm an Environmental Health Officer within the Regulatory Services Unit. Our teams, Trading Standards, Licensing and Environmental Health, have been working really hard throughout the pandemic supporting businesses. Over the last week, we've done 150 visits to businesses, and that's included investigating complaints, workplace outbreaks and offering advice and support. We've done this throughout the pandemic and we'll continue working with partners to make sure that businesses remain COVID compliant.
And over the last few months, our relationship with NHS has continued to deepen. And Phil is here to tell us a little bit more about how that works day to day.
Over the last 11 months, the team have worked with approximately 1,300 people who required transferring from Milton Keynes University Hospital. And 800 of those, just over, have been through our reablement service. The social work team work with people at the beginning of reablement and at the end of that. So we refer into that service, they get support to get hopefully to where they were. If they do need ongoing care, that's when the social worker comes in at the end of it to plan that process and to get that support in. So significant numbers of people that we've had to work with in a really relentless way. The team have responded to government guidance, and as part of that, we've had to increase from working 5 days a week up to 7 days a week. So we've had to put that in place. The team have been really committed to doing that, and that's borne dividends for us. Yeah, we've also put in place designated beds. These are beds for people who are COVID positive that normally live in a residential care home. They can't go back to that particular care home, so they have to go into a designated bed before they do, and then they have to spend 14 days there to be clear from their test. That's now in situ and has been working well. Other authorities have struggled with that, so the team has done really well to manage that and put that in place.
Hopefully that was a useful update, and thank you for all the work you're doing to help us control COVID-19.